Hello friends, I'm Dr. Priya from Smile Zone Dental Speciality Center in Bangalore. Today I'm going to talk to you about autoimmune diseases and their effect on oral health. Autoimmune diseases occur when our immune system that is supposed to protect us from bacteria and viruses and other infections starts to attack our own body. Autoimmune diseases can have a profound effect on your oral health and can compromise your nutrition. Today we will talk about what we can do to counter the effects of medications and the disease itself. I will now give you some general tips on how to maintain your oral hygiene and counteract the effect of the disease itself or the medication that you're taking to reduce the effects of the disease. For instance, if you have dry mouth, it is very important to drink lots of water. There are many lubricating mouthwashes available which your dentist can recommend that will help keep your mouth moist and avoid diseases of the oral tissues. Also talk about fluoride sealants, fluoride varnishes and fluoride toothpaste for your teeth with your dentist so that if you are more at risk for cavities, they can do a fluoride varnish or give you fluoride rinses. It is very important that you consume a healthy diet, lots of fruits and vegetables and antioxidants to keep your gums and teeth healthy. There are many autoimmune diseases that can affect our oral health, like type 1 diabetes, rheumatoid arthritis, lupus, Sjogrens Syndrome, psoriasis, IBD and many such diseases. Today I will discuss a few particular diseases as well as give you general pointers when you have an autoimmune disease, how you can improve your oral health. Type 1 diabetes and gum disease are closely interlinked and it is a catch-22 situation since increased sugar levels make you more prone to gum disease and cause gum inflammation. On the other hand, gum disease and inflammation of the gums can also increase your sugar levels. So it is very important to maintain healthy gums and teeth with regular brushing, flossing, using a water flosser or a regular dental floss and visiting your dentist regularly. Diseases like rheumatoid arthritis and lupus, which are also common autoimmune diseases, can cause swelling in the joints. Usually they affect the small joints of the body, but they can involve the temporomandibular joint. The temporomandibular joint or the TMJ as it is normally called is the lower jaw joint. It attaches our lower jaw to the skull. There can be inflammation of this joint in these diseases. This can make you difficult to open your mouth, chew your food and brushing and flossing can become difficult. In the acute phase, anti-inflammatory medication will help, but it is important to consult your dentist, get a night guard made so that the soft night guard, which is a soft tray that you will wear in the mouth, will protect the jaw joint and not transmit unnecessary forces. This will decrease the pain and inflammation and help you chew your food better. Another autoimmune disease that has a profound effect on oral health is called Sjogrens Syndrome. In this syndrome, the salivary glands are weakened, leading to a decreased production of saliva in the mouth. When saliva is less, it can cause taste changes. It can also cause increase in cavities and gum disease as well. Lot of other options are available nowadays like lubricating mouthwashes and of course maintaining good oral hygiene and drinking lots of water will also help. Another autoimmune disease is called Crohn's Disease. Crohn's disease is a bowel disease and causes nutritional deficiencies. It can also lead to swelling of the gums. People with Crohn's disease are very prone to mouth ulcers, which can be very painful and uncomfortable, making it difficult for you to chew. Movement of teeth can also occur in Crohn's disease. In these specific cases, you need to consult your doctor who will give you some gel to apply in case you have ulcers. Gum swellings or movement of teeth will be treated on a case-to-case basis by your dentist. Another disease which is also autoimmune nature is called Hashimoto's disease. Hashimoto's disease does not directly affect our teeth and gums, but it can cause swelling in the neck and the throat, which will make swallowing difficult. And swallowing difficulties can affect chewing capability and also affect the teeth and gums indirectly. Lupus is a very common autoimmune disease in the spectrum of these diseases, and it can cause lesions in the mouth, and again it can cause ulcerations, in which case you need to consult your dentist and take the required medication. It is noticed that in people with autoimmune diseases, there is a damage to the blood vessels and nerves, and that makes you more prone to gum disease. Maintaining impeccable oral hygiene helps. Also, a lot of medication that is used to treat autoimmune diseases can cause dry mouth. Saliva is a very important component that has the function of protecting our teeth and the oral tissues. It keeps them healthy, it flushes out the debris and the plaque. Absence of saliva creates an acidic environment, and this can cause an increase in cavities. If you suffer from chronic ulceration or frequently get ulcers, inform your dentist and they will recommend some good oral gels which you can use to counteract the pain if you get an ulcer. Also, do not forget to take nutritional supplements and a healthy diet to avoid ulceration. Stress has a very important role to play in terms of your autoimmune disease. It can aggravate your disease, and it is very important to manage stress. Managing stress often reduces the frequency of ulceration. So if you're suffering from an autoimmune disease, don't get disheartened. The best thing is to go that extra mile and to take special care of your teeth and gums to make sure that your teeth last you for a longer time. Your dentist will help you and partner you to maintain your oral health. It is important that you do the basic oral hygiene practices. Brush twice daily. If you have mobility issues, for example in rheumatoid arthritis with your fingers, go ahead and use an electric brush. Use a water flosser or the thread floss. Make sure you use it once at night every day. Ask your dentist to recommend you high fluoride mouth rinses or toothpaste so that you do not get cavities. Use lubricating non-alcoholic mouthwashes and make sure you enjoy your food and have good nutritional food. This will go a long way in maintaining your oral health and also keeping your autoimmune disease in check. I hope this helps everyone who is listening to this.